Hello, I am Dr. Manu, Aster Hospital UV. I'll be talking on a new thing that is known as ACE2 and COVID-19. So studies shown that how this COVID-19 will enter into the human body. They will enter into the human body by binding with the receptor known as ACE2. The full form is angiotensin converting enzyme 2. So various studies have shown that in the oral cavity, in the oral mucosa and in the tongue, these ACE2 receptors are there and they are in plenty in fact. Even in the lungs we have got ACE2. So once the virus will bind with this ACE2, then it will slowly spread in human body. Okay, so the advantage is like we have found out how this virus enters. So is there any way to prevent the entry? So most of the studies are now focusing on blocking this ACE2 so that the virus entry will be arrested. Another controversial thing is one of the common BP medicine that we all used to take, like captopril, lisinopril, or even losartan, telmisartan. These are the drugs that can increase the level of ACE2. So that means I just now told if the ACE2 is more, the receptors are more, that means virus can bind with these receptors more avidly and more frequently or more easily. So they will enter into our human body. So this studies has to be like there are no authenticated studies definitely that these drugs can harm, but theoretically speaking, this can produce more ease for the entry of the virus in human body. Another thing is that ACE2 can be seen even in the lung, so that will help in producing pneumonia. So vitamin D may help in a paradoxical way that this entry of the virus can be arrested to an extent. So this also need to be substantiated with further studies. So I'll summarize the talk like this. Probably the future target will be ACE2. So if we will be able to block ACE2, I'll be able to prevent the entry of the virus. So even if somebody is exposed, the virus will not enter into his or her body. Thank you.